A woman walks into a dental clinic 2 days before her wedding. She opens her purse, takes out a small jar, white paint, and asks completely seriously, "Doctor, can you paint this tooth for me right now?" When my colleague first told me this story, I laughed. I thought it was a joke. It wasn't. This actually happened in a real dental clinic with a real patient who genuinely believed paint was a solution. Let's call her Anna. She was 29 years old, a bride, exactly 48 hours away from her wedding. The dress was ready, the venue was booked, guests invited. Everything was perfect, except one thing: her front tooth, a lateral incisor. It had a noticeable dark discoloration. An old filling placed about 10 years earlier had changed color over time, a dull gray-yellow shade that stood out against her other teeth. And honestly, it hadn't bothered her much until she saw her rehearsal photos. On every picture where she smiled, that tooth jumped out immediately. It felt like the camera was targeting it on purpose. Panic set in. Wedding in 2 days. Hundreds of photos. Video recording. And that tooth would be in every frame. She started calling dental clinics. "Can you fix this urgently?" The answers were always the same. Whitening takes time. Replacing a filling isn't instant. Veneers require multiple visits. And then she had an idea. What if I just paint it? The logic was simple. If you can paint your nails before an important event, why not paint a tooth? She went to an art supply store, bought a jar of white gouache paint, and walked into a dental clinic with a plan. The dentist looked at the jar, then at Anna, then back at the jar. "You're serious?" "Completely. I just needed to look white in photos. It's paint. It's white. What's the problem?" So the explanation began. First, gouache paint is not a dental material. It's not designed to be in contact with oral tissues. Pigments, binders, chemicals, all of it can cause irritation, allergic reactions, or toxicity if swallowed. Second, paint doesn't adhere to wet surfaces. Teeth are constantly covered in saliva. The paint would wash off in minutes, or worse, smear during the ceremony, leaving white streaks on her lips and tongue. And third, it's paint. Here's the thing. People panic before big life events. Emergency dental visits right before weddings, job interviews, TV appearances, they're incredibly common. Some people ask for instant whitening. Others demand a veneer by tomorrow. Some want a complete smile makeover in 24 hours. But bringing gouache paint? That was a new level of creativity. The dentist предложил реальное решение, an express polishing of the filling, a quick cosmetic correction with composite material. One visit. The result wouldn't be perfect, but the tooth would look lighter, cleaner, and blend naturally in photos. Anna agreed. An hour later, she left the clinic smiling. Genuinely smiling this time. The jar of paint went back into her purse. "Just in case," she said. "Maybe I'll use it for decorations." But this is what sticks with me. How many people under pressure are ready to do something absurd? Paint a tooth, glue something on with superglue, try home remedies that are useless at best and dangerous at worst. All because we postpone dental care. We live with small problems for years, and then 2 days before an important moment, we panic and grab the first idea that comes to mind, even if it's a jar of children's paint from an art store.